Hey, so my name is Sarah Woolsey. I'm Medical Director with Comagine Health, and this is an infection prevention update for long-term care facility partners in the time of COVID-19. And today is April 10th, 2020. I'm the Medical Director for System-Wide Quality Improvement for Comagine Health, and this presentation is directed to long-term care facilities, skilled nursing facilities, long-term acute care facilities, assisted living and independent living facilities, and home health and visiting essential service providers. Our objectives are to share updates from the Department of Health on infection prevention in Utah long-term care facilities. We're going to describe best practices for screening healthcare workers for COVID-19 for your facility and describe best uses of PPE for transmission prevention in your facility. This comes from Department of Health recent guidance from 4/6/2020, and you'll see the documents linked here for your reference. Our key messages are, as you know, long-term care facility residents are highest risk members of our community. Healthcare workers are the most likely source for transmission based on data from outbreaks, and we'll talk about that. Visiting healthcare workers are at high risk for transmission between facilities, and appropriate PPE is important for prevention for every patient encounter. So just some background, healthcare workers are a significant source for outbreaks. Pre-symptomatic and asymptomatic carriage of COVID-19 is significant. So before we get sick, we may have that COVID-19 virus in our nose and our mouth and be able to transmit it to our patients. Data from King County, Washington from March 2020 showed that once there was one positive case in that facility, within 16 days, 30% of residents were positive for COVID-19. Screening for healthcare workers is critical. CDC guidance recommends screening all healthcare workers for exposures and symptoms: cough, fever, shortness of breath, tracking temperatures. We want ill healthcare workers to notify their supervisor, cover their nose and mouth, exit the facility, and seek assessment for COVID-19 from their own healthcare provider, who can give them guidance in taking care of themselves and when to go back to work. If available, all healthcare providers should wear a face mask and gloves to prevent asymptomatic spread while caring for patients, also attending to hand washing. This is a tool that was developed by Utah Department of Health long-term care facility in response to the COVID-19 pandemic. This is a screening tool that could be implemented either at the entrance of a facility for routine screening of your healthcare workers, or also for traveling healthcare workers as they visit various facilities. This tool gives both directions for assessing one's risk of transmission of COVID-19, as well as a tool for communicating with leadership in a facility to make sure that the PPE available is appropriate and to make sure the healthcare worker can remain safe and protect the residents of that facility. This is a stop, think, assess document where every interaction assesses your highest risk encounter and communicates that. So this tool can be used in your facility, is linked in our documents, and is available at the state website. On the back side of the tool, there's a self-tracker. So if you are someone or have staff that travel between facilities, this is a way to document both COVID positive facility exposure, think about patient exposure to COVID, reminds you of what PPE is appropriate to use, reminds you not to bring extra equipment into your visits because those become risks for transmission of the virus. And then there's data tracking tools. So feel free to adapt this to your needs. We think it could be helpful for raising awareness and educating in your processes. And then finally, just a reminder, again from our state guidance, universal PPE is guidance for all long-term care facilities. So symptom screening alone is not going to prevent large outbreaks from occurring. We want to make sure folks have appropriate PPE, hand washing, and surface cleaning as best practices. Those are critical to outbreak prevention. Every facility needs to develop their plan for moving toward this goal while identifying and maximizing their PPE stores. Let's talk more about PPE best practices and contingencies. Many of you are likely sewing and or using homemade masks. This is a part of the reality of the crisis for PPE availability in our state and in our facilities. And this is a particularly cute pink mask here. But let's talk about infection prevention basics. We're going to talk about hand hygiene and touching our face in the T-zone, disinfection best practices, evaluating the PPE you need, and then how do we use PPE in crisis. So hand hygiene, this is basic. We all need to continue with our hand hygiene programs. We want to include our residents in this program. We want to make sure that residents are able to have available alcohol-based hand sanitizer and use that before meals or use that after toileting. Products include alcohol-based hand sanitizer and soap and water. Those are both highly effective against coronavirus when used properly. Think about using the WHO hand hygiene self-assessment in a QAPI. The link is at the bottom. This could be part of your best practices and process improvement to maintain hygiene as core, even with the outbreak with COVID-19. Reminder not to touch our face. Okay, don't touch the T-zone of our face where the virus is likely to be most active. We need to have self-awareness, but that's probably not enough. We need to identify triggers of when we're likely to touch our face and work on supporting folks with that. We need to consider implementing peer feedback. If we see folks touching their face, remind them to do hand hygiene. And hair often is a place where we're going to put our hair behind our ears or get it out of our face. Consider tying a long hair back, wearing hair caps such that the hair does not become an issue for infection control. Disinfecting surfaces, again, another basic for infection prevention. These are some best guidance on COVID-19 survival time: up to 24 hours on cardboard, 72 hours on plastic and stainless steel, 3 to 5 days on the other substance here, including metal like a doorknob. So be thinking about that. Frequent, regular, routine disinfecting is advised. You're going to want to use gloves when you perform hand hygiene after you disinfect. EPA List N is linked here. These are the disinfectants that are strong against SARS-CoV-2. And remember that you want to follow the directions. Make sure the surface is clean prior to disinfecting and make sure you follow those dwell times to get your maximum effect. Remember to clean and disinfect equipment shared by residents. If you can't dedicate equipment to residents, then you want to make sure and clean and disinfect when that leaves the room. Disinfection is performed outside the resident room. Contaminated equipment should be appropriately bagged or immediately brought to an area designated for disinfecting. Use those typical processes that you already have in place and just really up your game and have those be regular and monitored. This just talks about the guidance for PPE for COVID-19 that's current from the CDC. So it gives us a sense of our resident situation, what staff PPE is recommended, what we do with our room, and then obviously protecting folks from transmission from a resident outside the room. So if someone's got respiratory symptoms, COVID-19, or suspected, we're going to need to ensure gloves, gown, eye protection, and face mask. So universal face mask, adding those gloves, gown, and eye protection for the folks as we enter cares. Okay, we're going to keep our rooms closed or have private rooms for folks. And then we want our residents to wear face masks or tissues when we're giving them care, additionally when they go outside their room. If we're doing nasopharyngeal swabbing or other aerosol generating procedures, and let me just list those from, let me just list those for you. Aerosolized generating procedures include nasopharyngeal swabbing, like I said, nebulizers, CPAP or BiPAP, open sectioning, high flow oxygen, intubation, ventilation, chest PT, or cough assist. In those cases, we want our staff to use N95 respirators or face masks if the N95 is not available, and then throw away that equipment or wash that gown after that encounter. Ideally, we have a negative pressure room as well for those procedures. This is just a list of PPE and crisis terminology. I'll be talking about a few of these things today. This is for reference. We will be talking a lot about reuse, which is removing, disinfecting, and then keeping that PPE for later use. And then extended use, which is using PPE for multiple patient cares while maintaining that PPE in place. Let's talk about gloves. Remember, gloves, no matter what, are for one patient only, okay? They need to be used for all contact, droplet, and in aerosolized situations, okay? Remember, glove removal is critical to maintaining best practices, and always sanitize after removing gloves. Remember, if you need to preserve gloves, you can use the same gloves for the same patient and sanitize with alcohol-based hand rub between procedures. But again, that's only for a single resident, not between residents. Remember that if you contaminate your hands when you remove your gloves, you need to do excellent hand hygiene. Isolation gown use. We know that there's increased use of washable gowns, and we'll talk about that a little more. That's going to impact laundry operations, and you're going to want to plan for that as you have more washable gowns. You are allowed to use disposable gowns beyond expiration for crisis, and you can extend use, which means using a gown for more than one resident with the same condition and in the same location without concern for additional co-infection. So again, if you have a COVID positive wing, you may extend your gown use between patients, but not with a COVID positive and a non-COVID positive patient. Remember to prioritize your gowns, cluster tasks, so doing multiple things at once, maybe bringing in food, doing vitals, medications at the same time to reduce the need for gowns. And remember, for any close contact or prolonged contact, a gown is needed. Remember, you can reuse cloth isolation gowns as long as they're laundered appropriately. And then as you're using the gowns, when you take them off, don't touch the outside or front. Those are the dirty sides of the gown. For cloth isolation gowns, just remember, these can be safely laundered as long as you use routine procedures with the right kind of heat and dryer heat for reuse. Your laundry and operation personnel may need to do more cycles because there's more laundry. And then you want to just check that you routinely inspect gowns for any defects and replace them when they're no longer safe to use. This is just a cute picture of staff gowns being hung out. For eye protection, remember, eye protection can be used beyond expiration date in crisis situations. Extended use for multiple residents, it could be used so you just leave that on your face as you're caring for residents. You can also reuse and do that between staff. Just disinfect appropriately in store, and then the next single user can use that. Remember, you don't want to touch the front of the eye protection. You want to take them off with the ties or strap only. You don't want to hang them around your neck. And then remember, for hand hygiene, if you're reusing your eyewear or your face mask, that's absolutely appropriate. You're going to want to perform your hand hygiene, put on a fresh pair of gloves, disinfect the surface where you're going to be using to set your shield, remove your goggles and face shield, disinfect them inside, then outside the dirty side, and then hang them to dry and store properly for reuse. Our face masks for non-95, so this is the surgical face mask, or could be cloth. Extended use is appropriate for multiple residents as long as it doesn't get soiled, become torn, or no longer cover the face. Okay, we suggest one healthcare worker per mask. Obviously, you don't share these, and you can reuse them at the end of a shift if they have not been soiled by folding the dirty side to dirty side out, put them in a paper bag for storage for use another day. Remember your priority conditions. If you don't have masks that CDC is acceptable, using a face shield with a cloth mask, that's an option to consider. And face shields can be re-washed and reused, so that could be an appropriate combination for your folks. Just remember, again, when you take your mask off, don't touch the front. All right, these are just folks hanging their goggles to dry and their face shields to dry in the shower with labeled times for the dwell time. Utah resources for face shields. We have a local company making face shields. So I have a link here for the Sugar House Awning Industries. Again, they've been doing this for about 2 to 3 weeks now, producing for Utah facilities. N95 respirator use. Remember, these are going to be most important to use in your aerosolized procedures. Some facilities use these for any COVID positive patient, but you're going to want to make sure you have them for aerosolized procedures. Make sure you train staff in seal check, and may want to consider a contingency for, or excuse me, a competency checklist for that. You can use these beyond shelf life. You can reuse these. One person can reuse and store them. We see the paper bag there that the mask is hanging on the paper bag facing in. You can also choose to extend use for multiple residents with same conditions ideally, but after an aerosolizing procedure, you need to get rid of it. Obviously, also if it gets contaminated for some reason, other reason, or if the seal check fails. So just be very careful with your N95s. These we can really extend and reuse per person if we're careful with them. Couple of CDC references we think are good. Potentially put these up as signage for reminders for training of folks on how to take your PPE off and the sequences with which to do that, such that you avoid contamination of yourself as you do that process. So use these as references. At the end, I'll also show you some videos we have that can help with this in teaching. Resources. Here's a bunch of links to hand hygiene. We think are particularly good. Some are videos, some are static documents. Take a look at these and see if this could be used for training or for examples for you to learn, for you to use with your staff as you're describing the best practices. These are PPE videos about reuse, about donning and doffing, disposable PPE. So this is another great set of training tools. Feel free to use these, are open source. And then resources that we have mentioned in the talks. These are all here in one place in case you want to check them out. For going home, just two things we like to say. Our staff feels safer if we've given them guidance on how to go home and stay safe. The American Academy of Family Physicians has a document, as well as CDC, about how to change clothes, take those home, wash those appropriately, disinfect shoes, make sure you're keeping your cell phone clean. We'll talk about this a little bit in the next section, but here's two documents that may be helpful to have your staff keep their families safe. I want to thank you for being interested in this topic, for getting yourself updated to the latest state guidance and CDC guidance, and we'll see you in the next section on really putting it into practical use. Thank you.